Welcome to Deuk Spine Institute, November 26, 2024. We are performing sacroiliac joint treatment where the patient has horrible pain in her SI joint because she's had a fusion, and now the SI joint is the next joint down below the fusion, and the pain she's having is coming from both SI joints, so we're going to fix both today. The treatment we're chosen for her is the sacroiliac joint Deuk plasma rhizotomy. And what this is a deadening of the pain nerves that are innervating the SI joint. It's a established procedure, and it's been around for years, but it's never been done the way we do it. We don't use radiofrequency ablation. We actually use a more powerful probe than the RFA probe. This is we call it the plasma wand shot. And basically what's happening in our treatment is we are going to where the pain nerves live and we're destroying them. Why? Because by getting rid of these 5 pain nerves, these 5 nerves that bring pain from the joint up to your brain, you get rid of the SI joint pain. And it works amazingly well, and it's safe, minimally invasive. It's done with a 4mm incision, tiny incision. And basically, all you got to do is march along the bone right here where the nerves come out of the sacrum. You can see where the nerves come out. Let's show them shot. Shot. All right, you can see the ostia, which are the openings for the nerves. And we are lateral to those because the pain nerves come out of those ostia and then they run. Show us where they run, Jordan. They run laterally from there out to the joint. Well, that's too far. Show us the joint. Yeah, can you guys see the joint right there?
Yes, we can.
Kind of a C-shaped joint. So those nerves run from the ostia out to the joint and innervate the joint. As they about to enter the joint, then you can eliminate pain in the joint. And the procedure is called a rhizotomy. But as I said before, traditionally it's been done using radiofrequency ablation. But radiofrequency ablation never fixes the problem because the nerves just grow back. So we decided we need something more powerful and something that can be wanded. In other words, moved from location to location along the bone surface to sever the pain nerves so that we get a permanent effect and the patient doesn't have to keep, coming back over and over again. All right, Henry, let's show our audience how the Deuk plasma rhizotomy works for the sacroiliac joint.
Of course.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Okay, you can see from our video that the sacroiliac joint becomes injured, like many things in our bodies, from what's called trauma. Trauma is where a force is applied to the body in such a way that it's transmitted down to the joint, and these joints tear because they have a capsule, and once the joint is torn, well then it starts to wobble around and it becomes what's called unstable, where it creates pain from inflammation, and the body is trying to heal the joint, but it just can't. So you have all this inflammation that's created, and the patients have horrible arthritis pain from the inflammation. Okay, that's why osteoarthritis is an inflammatory condition. It is a disease of inflammation. A lot of people don't know that it's a disease of inflammation. But it is. Osteoarthritis is a disease of inflammation. You've heard of rheumatoid arthritis, it's a disease of inflammation. There are many, 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 many diseases of inflammation, right? Even atherosclerotic disease that causes strokes and heart attacks is a disease of inflammation. So it's inflammation happening in the wall of your small arteries that go and feed your heart, and they cause heart attacks. So inflammation is a important defense system in our body, but at the same time, inflammation, if it is out of control, will cause problems by destroying your body. While it's destroying that part of your body, it causes pain. Shot? All right. Need to be a little more lateral. Now she's interesting because she has a medially projecting iliac bone, and that's pushing my probe away from where I want to go. But I'm going to have to fight it and aim laterally. Shot? Yeah. Nice. I'll take the question, by the way.
Of course. Coming from two questions. First one coming from Lanu on YouTube asking, does the patient feel anything when the nerve is cut during the surgery?
Well, the patient is asleep, so she is out. Sleeping. She won't feel much. Shot? She's, sedated. We call it sedated. There should be no feelings that are bad by her. Man, she has a deep joint. Yeah, these joints can be very deep. Hers is definitely deep. Her cortical bone is good. Her joint is just very deep. Any other questions?
Yes, coming from Beth on YouTube asking, can the plasma rhizotomy be done to fingers?
Beth, that's a really good question. The answer is yes. We have done it before to digits. We've treated fingers. As a matter of fact, we have actually, you know what, Beth? Go to our YouTube channel. There's a patient who had a thumb done, and he just did his testimonial 1 year after his surgery, and he says his pain in his thumb is gone.
I could put the link.
We did a toe, we did a thumb, we did an ankle, a foot. So yes, this Deuk plasma rhizotomy works for every joint in your body that can have arthritis pain. And we've done a lot of different joints. I don't know if we've done an elbow. All right. Any other questions?
No current questions, so we do have a comment coming from Carolyn on YouTube.
Hi, Carolyn.
saying, thank you so much. I appreciate it. I definitely will see you at some point for the short procedure. I am tired of this pain. I've had it from the neck. I have it from the neck all the way down.
Yeah, Carolyn, I'm sorry you're suffering, and we're here to fix pain like yours. We can fix it. Unfortunately, it can't be done in every doctor's office, but Deuk Spine specializes in the latest treatments for spine and joint pain, and that includes this procedure, the Deuk plasma rhizotomy, and the Deuk laser disc repair. Any other questions?
No current questions.
Do me a favor, Henry, run the video one more time. We just created this animation to show you how we deaden the pain nerves for the SI joints to treat sacroiliac joint arthritis inflammation pain, which is what everybody that has SI joint dysfunction, they have that same pain. It's replacing the fusions. You don't need a fusion anymore of the SI joint, sacroiliac joint. You just need the Deuk plasma rhizotomy. Thanks for joining us, and we'll see you next week after Thanksgiving.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK.